Right. So we are doing the lymphatic system and the immune system or the immunity, and we will be covering different parts, including what are the different functions of this system, which is very important, basics, the 4Ds, we call it, drainage, delivery, disposal, and defense. Excuse me. And then what are the organs in this system? Lymph vessels, lymph nodes, thymus, spleen, tonsil, five organs, and body defense, how the body defend itself in different categories or in different layers. The surface barriers will be the first one, followed by the innate immunity, which is what we are born with. It doesn't need any like training or practice or anything. And then the last one would be adaptive, which is something that we adapt to. So it needs actual experience. So the lymph vascular system, or the 4Ds of this system that you have to know, very important to know, because basics, like this is the ABC for this chapter, one of them, which is the 4Ds: drainage, delivery, disposal, and defense. And you need to know what each one of those means. Drainage is they drain the extra fluid that leave the capillaries that we talked about before last week. Remember that there is some fluid, which is water and solutes, that leaks out of the capillaries, go to the cells carrying the good stuff, and a good part of it will return back carrying the bad stuff back to the blood and then back to the heart. But I told you guys before that not all of it will go back. Like 10 leave the capillaries, go to the cells, 7 or 8 go back. So how about the difference? Yes, it will be drained by the lymphatic system, and this is what we're talking about today. This is one of them, draining the extra fluid that collected in between the cells. Delivery. This is one of the functions, but this is not a defensive function. It's not for defense. It's just an additional function that when we eat food and we break down the foods in our digestive system, you end up absorbing that food, or the tiny parts of that food would be absorbed and leave our intestine, our small intestine, and go into the blood. It goes like this, but there is an exception here. If you guys remember, we talked about the different types of foods: carbohydrates, fats, proteins, and nucleic acid, the four organic compounds or organic types of nutrients. Carbohydrate, fat, protein, or carbohydrate, lipid, same as fat, but lipid is more accurate, and proteins, and then nucleic acid. When you break those down in your food, it leave the intestine, go to the blood. This is true except for the fat. The fat doesn't go to the blood. It goes to these lymphatic vessels. And these lymphatic vessels are going to take it. When it's absorbed, it will take it. From there, it will send it to the blood anyway, but indirectly. It give it like a shunt, like a delivery. It deliver it. And this is the second D. Third D, disposal. Dispose anything that's not supposed to be in the blood. Uh, Foreign material, it will transport it and send it where we will get rid of it. Debris, like remnants, something remaining, like your white blood cells, for example, is fighting and it's broken down. There are remnants, cells that are destroyed. There are remnants. The foreign material itself, bacteria or virus or whatever, it will dispose it. It will transport it and then get rid of it. It will send it to the lymphatic vessels and then it will be disposed later. The last one is the defense against pathogen, and this is the one that we will discuss in details. So these are the 4Ds that you need to know, and you also need to know the different organs and the function of each one of those. We have lymphatic vessels, like look at this green here, all these tubes, like vessels. Remember when we talked about the vessels in the previous chapter last week, we said like arteries, arterioles, capillaries, venules, and veins, starting from the heart to the arteries, arterioles, capillaries, and then venules, veins, going back from the heart to the cells, arteries, arterioles, capillaries, and then from the cells back to the heart, from the capillaries to the venules, to the veins, the big veins, back to the heart. This is a different system, but it's the same idea. Like remember, from the heart, arteries are big, arterioles are smaller, and the capillaries are the smallest. Here we have the same thing, but we call them lymph vessels. There are big lymph vessels, smaller and smaller. So this is a completely different system that consists of vessels. We call it lymph vessels. And why did you call it lymph vessels? Because it carry lymph. The other ones are called blood vessels because they carry blood. Arteries, arterioles, capillaries, venules, veins, all of these are blood vessels, vessels that carry blood. Here it is lymph vessels, vessels that carry lymph. What's a lymph? The lymph is this extra fluid that I just talked about that stayed in between the cells. It will be drained. And this fluid that we're draining is called the lymph. As you're moving in these vessels, as the lymph moving in these vessels, it will counter, look at these nodes, like this, like these, like these. These are lymph nodes, which is the second organ here. And uh, when the lymph, of course, is not cleaned, and that's why you are draining it through this system because you know it's not clean. You take it in from in between the cells, and it can carry anything that's not needed. So you send it in the form of lymph to the vessels, and as it is moving, it will encounter or it will go through lymph nodes, and these lymph nodes are going to take the bad stuff and destroy it. The other system is called thymus, and this is right here in front of your heart, and this is the one that will activate one of the components of the immune system, which is the T cells. And this is where the T came from. You will see it later. When we did the blood, we talked about red blood cells, white blood cells, and the platelets, if you still remember. And I told you that the white blood cells can be neutrophils, eosinophils, lymphocytes, right? Lymphocytes. This is what we're talking about today. Lymphocytes. So lymphocytes can be T and B lymphocytes. We will discuss the details. But T lymphocytes, this is important to remember. Why? Always ask why. T lymphocyte. What do you mean by T? The first letter of thymus. Because this organ, thymus, here in front of your heart, is the one that activates this type of lymphocytes. And that's why we call it T lymphocyte. There are also spleen and tonsils, and we will need to know the functions of these, and it is coming. Spleen basically store red blood cells and destroy the older red blood cells that not needed anymore. Tonsils are guarding the openings, like when the air enter from your nose or air and maybe and food enter from your mouth, it's not completely clean. So these tonsils are guarding the openings, the entrance to the body. So again, here is the lymph, which is that fluid that is drained out in between the cells and moving within the lymph vessels. We call it the lymph. To look at this is what I just described. Oxygenated blood leave the left ventricle, go to the aorta, and move within the arteries, then arterioles, and then capillaries. Right here, this is what we're talking about at this point here. a good part of the fluid component of the blood, which is good part of the plasma, is going to leave here. You see this red part of the capillaries is going to leave here. And there are cells in this white area here. It's not in the picture, but I'm telling you, there are cells here. So it's going to leave and go to in between these cells. The cells will take the good stuff. Remember, this is oxygenated. It will take the oxygen and nutrients, and then it will produce carbon dioxide and waste products that will go back to this side of the capillary, the venular side of the capillary, to the venules, to the veins, superior inferior vena cava, to the right side of the heart, right atrium, right ventricle, and then it will go to the pulmonary arteries, to the lung, pulmonary veins, back to the left side, and so on. It's going around all that time. But here is my point, to be specific. The fluid that leave from here go to the cells is more than the fluid that goes back. The part that stayed in between the cells is staying here for a reason. It is nothing is random. Everything is happening for a reason. So the fluid that stay in here, it will be drained by these lymphatic capillaries. And this is happening on purpose because you want to get part of this fluid part of the blood through these vessels. And when it encounter these lymph nodes, it will be cleaned. So by the time it goes back to the veins and back to the heart, and then the next cycle, you will take another portion and pass it through this, cleaning it, killing the bad stuff, getting rid of it, and so on. And then it go back to the veins, so the heart, lung, come back to the heart. You go to the cells, capillaries and cells again. A portion of it is going to go to the lymphatic capillaries. I'm sorry, just a second. Yeah, go to the capillaries to be cleaned, then go back, and so on. Here it is, a bigger picture. These are the arterioles. Blood go to the capillaries. Part of it leave to go to the cells here. This area contains cells. And then it will go back to this blue side. So it leave from the red side of the capillaries. We call it the arteriolar side. Go to the cells, give them the good stuff that they need, oxygen and nutrients. The cells take what they need and release what they don't need. Oxygen, I mean carbon dioxide and waste products, which will go in again to this side. Not all of it. Whatever remain, look at these blind-ended lymphatic capillaries, it will take it as an alternative route for drainage. Look at these flap-like valves here. So the lymphatic vessels also have valves. I hope that you guys still remember when we talked about arteries and veins, veins have valves. Also, lymphatic capillaries have valves. Why? Because the pressure here is very low. So maybe the lymph will move like this in the lymphatics, and then it goes back because there is nothing much pushing it. The muscles contract and push it, but it can go backward. To prevent that, we have valves. Then you will go through the lymph nodes like these. You go from one side. The valves allow you to go from one side. Inside here, it's going to be cleaned. This lymph will be cleaned. And the lymph contain lymphocytes and macrophages. And you need to remember this. Two types of cells, lymphocytes and macrophages. And then it will leave from the other side clean. It goes not clean, and then it leaves from the other side clean. And this is how it looks like. Look at these flaps or flap-like. It acts like a valve. Now the organs. So we did the vessels. How about the organs? This slide is extremely important, specifically, because these are the different organs, and this is like the basic function that we need to know. So lymph nodes, like, oh, look at these bead-shaped structures here, all of these. These are lymph nodes. These lymph nodes are the one through which the lymph will pass through. I just showed you the picture. This is a bigger picture. It goes from one side, it will be cleaned, you get rid of the bad stuff, and then it will leave through the other side. These are the lymph nodes. Here are, it's usually in these locations, right here, right here, right here, right here. I don't know if you guys ever noticed that or not, but if you ever go to the doctor for general examination, they usually do like this. They put their fingers like here, and they put it like in your axilla or armpit, and they put it like here in the groin region, and they put it right here, and they put it here in the elbow. They're doing that for a reason. These are the locations, the major locations for these lymph nodes. Like they put their hands here and here, and inside your in the side of the neck, like here, in your elbow, in the groin region here, and so on. They're doing that for a reason. They are feeling if these lymph nodes are enlarged and hard or not. If it is enlarged and hard, this is not normal. It's not supposed to be. And this is what they are looking for. If that's the case, there should be something going on. Maybe infection, maybe even tumor or cancer or something. Most of the time, it's infection. So if that's the case, they can give you a treatment. So what types of cells do we have in the lymph nodes that we need to know? Lymphocytes and macrophages. Lymphocytes and macrophages. Lymph, to remember it, lymph, LM, lymphocyte and macrophage, LM, lymphocyte, macrophage. Lymph nodes contain lymphocytes and macrophages. What are these lymphocytes and macrophages doing? Clean or clear the lymph, the fluid that we just talked about, of anything that's not supposed to be there. Are you supposed to have bacteria? No, but there is bacteria. Foreign substances, you're not supposed to have it. It will clean it out. Thymus, I talked about it. The letter T came from the first letter of thymus, T cells. What are the T cells? One of the different types of lymphocytes. Remember when we talked about the blood, red blood cells, white blood cells, different types. One of them is lymphocytes. And lymphocytes is T and B. T come from the thymus. So this is needed for the lymphocytes, the T. What does it do? Like the thymus, what does it do for the T? This is where the T lymphocytes are maturating and multiplicating and specializing. The thymus helped them to do that. And that's why they got their name from the thymus. Spleen, right here within this circle. This is the largest lymphatic organ. Again, this slide is basics. This slide is important. Here is the spleen, the largest of all. Compare it to anything here, even to this. Look at this. Excuse me. Look at this green structure here within this blue circle. This is the thymus. The thymus is big, at least in the beginning of life, like in babies and children. It is bigger than the lymph nodes, though. But look at the spleen, the largest. And this will filter the blood, get rid and destroy the aged red blood cells. Remember, I told you before that red blood cells survive for about 4 months, after which you should get rid of it or recycle it because it wouldn't do the function anymore. It's old. So this is the spleen. Filter the blood. If the blood is aged, not good anymore, we break it down and we will recycle most of it. But the other function is also storing some of this blood. It doesn't just destroy the old ones. When the blood go through it, it will store part of the red blood cells when you until you need it. We call it reservoir. And if the spleen finds some older red blood cells, it will destroy it. And also it stores some macrophages. So this is like your pantry. This is like your reservoir. You keep some red blood cells and macrophage for the future when you need it. Next organs are the tonsils, and I told you that the tonsils are guarding the openings. Like, look at this mouth, food, drinks, food and drink and even air can enter from here. And as it goes in, it will find these tonsils guarding the openings. Like this tonsil under the palate is called palatine tonsil, and this tonsil behind the tongue is called lingual. Lingual is Greek for tongue. So it will find those. How about the other opening from which the air enters? The nose. Yes, there is another one here that anything going in, it will go through the pharyngeal tonsils, or also called adenoids. Adenoids. Pharyngeal tonsils or adenoids. So the air is moving in. The tonsils here are going to interact with it, and it will kill any germs that are moving in with the air. It will kill it. All these three types: adenoids, palatine tonsils, and lingual tonsils. Here is palatine, and this is the lingual. And if you go to the doctor, they ask you, like, open your mouth wide, let me see. They are looking for these ones specifically, those two, the palatine tonsils, because it shouldn't be visible. Or if it's visible, it should be very small. If it is big, it means there is something going on, like infection or something. So lymphatic system is working with the cardiovascular system because it takes the extra that's leaving. Consists of lymph nodes, lymph vessels, thymus, spleen. Tonsils is part of the immune system. The 4Ds: drainage, delivery, disposal, and and you need to understand the meaning of each one of those. And we talked about it. Now, let's go more into the details of the 1D, that's defense. Defense against any threat, any invader, any pathogen. How are we protected? How is this system going to defend us? It goes into levels. First of all, we are defended, or we are protected by the physical barriers and the chemical barriers. Like the first line of defense, if something is trying to invade you, like pathogen in the air or in your skin or something, why it doesn't invade us? Like why we are not always sick? Because we have cover, physical barrier. We have physical and chemical barrier covering everything from outside. And that's why if you have a cut wound or something, you get infected. If you don't have cut, you don't get infected most of the time. Why? Because of this physical and chemical barrier. Physical barrier is like your skin. Your skin is covering your entire body. Is it only the skin? No. There is the lining of your mouth, the lining of the cavities inside, the lining of your nose. All these are physical barriers. So this is your primary defense. It's called the physical and chemical barriers. Physical, okay, like skin, something try to go through, it cannot. It's a barrier. Like the mucous membrane inside our mouth and our nose, okay, we got it. But what's the chemical barriers? Yes, there are on the physical barrier, there are chemicals that's all over our physical barrier that also act as its own barrier. So we have two barriers together: physical barrier, skin and mucous membrane, and chemical barrier, the different types of chemicals associated with the physical barrier. What if something bypassed this, like you have a wound or something in your skin? So now the first line is gone. Uh, you're not protected anymore through this barrier. You have a cut wound, pathogens enter. Is that it? No, we have the next level, which is the innate immunity or non-specific immunity. Innate means You are born with it. It is something that you already have. It's working all the time. It will encounter anything. It's ready to defend you. If the first level failed, they are your second level, and they are waiting and ready to work. It work fast. It's ready. It's waiting for anything. But it is non-specific, meaning it will defend you against anything. So it is fast, non-specific. Pathogen, pathogen enters, it will fight it. Virus, it will fight it. Bacteria, it will fight it. Fungus, yes, anything. It's non-specific. The last one is the specific one. We call it the adaptive or acquired or specific. Why did you call it that name? Innate means it's natural and you're born with it. Um, just 1 second. So you're innate means you're born with it, ready to use. It's non-specific. The adaptive one, you need to be adapted to the different types of pathogens. So you are going to deal with them, understand them, and then fight them. So you have to adapt to them. And that's why this is acquired. What do you mean acquired? Meaning it's not innate. You're not born with it. It's not ready to use. It needs some practice. It needs some adaptive mechanisms. It's acquired. You acquire it. You take it through practice. That's why it's called acquired, and this one is specific because every one of those is specialized. If I see this type hepatitis, for example, virus, yes, I'm specific. I'm going to work against those. The different types of invaders can be are we can be pathogens, or we call it pathogens if it cause disease. If it cause infection, we call it pathogen. And this can be bacteria, can be virus, can be prions, can be fungus, can be parasites, or worms, or helminths. Most important, we will focus on the bacteria and virus. The bacteria are actual cells. They have their own membrane. They have their own nucleic acid or genetic material inside. Viruses are not cells. They are not cells. They are particles. So since they are not cells, they don't have the genetic material, so they do not work alone. They will control the nucleus of your cells and make your own nucleus of your cells, help them to reproduce. But the bacteria are actual cells, so they reproduce by themselves. Prions is protein, bad protein, fungus, and parasites. We will talk about it. But the most important are bacteria and virus. What's the difference that we need to know? Number one, bacteria is actual cells. Virus are not cells. Bacteria, it came from little stick like this. It's Latin. Virus, it comes from poison, which is not very accurate, but this is how they give it the name. But what's the main difference? The main difference between those two? Bacteria are actual cells, unicellular, like each one of those is alone, and it is big, while the virus are not cells and it is small. Bacteria, because these are cells, so they reproduce, while the virus, they cannot reproduce by themselves. Why? They are not cells. They don't have genetic material and like DNA and stuff like that, and membrane. They don't have it. They just invade, go to your nucleus, and use your own genetic material to reproduce, while the bacteria reproduce by themselves. Bacteria, if treatment is antibiotics, while the virus, not antibiotics. There are antivirals. And that's why you can go to the doctor and say, like, I'm sick, I'm like coughing and sneezing and stuff. And can you give me antibiotics? They will say, no, you don't need antibiotics. Why? I have infection. Yes, it's virus. Virus doesn't respond to the antibiotics because antibiotics, they work on cells, they work on the membrane, they work on the nucleus, but the virus doesn't have any of those. That's why it doesn't work against it. Now, your defense system that I'm talking about right now, let's say this is your defense system right here, this one. When something comes in or something is in there, or let me say it, when it encounters something, there are markers on that something, whatever it is. If it is a cell or particle or virus or whatever it is, there is a marker here, which is a protein that's most of the time it's on the surface. And when our system see it, it will recognize it and it will leave it alone. Can you give us examples? Yes, I can give you examples. Your immune system inside the blood, for example, when it's moving, and it finds red blood cells, does it attack your red blood cells? No. Why? Because this is one of your own cells. Yes, but how did you know? Like the immune system, does it have a brain or something? No. How does it know? Antigen. Antigen. There is an antigen, which is a marker on any of our cells or particles or anything. There is always a marker, and this marker, if this marker or antigen tells us that this is your own cells, we call it self marker. And when your immune system, the white blood cells are moving, red blood cells, they look at it, this is ours. I will leave it alone. This is self marker. It contains self marker. I will leave it alone. I'm not going to attack. Um, but otherwise, um, it is going to leave it alone. Other than that, if there is something that's not self, like pathogen, is that your own pathogen? Of course, it's an invader. Virus, foreign body. Um, if you're even if you're receiving red blood cells, we talked about that. If you remember, if you're receiving red blood cells, that's not your own type, so it doesn't have your own marker. Yes, if that's the case, um, it like this. Your immune system look why it's like angry like this because when it see this antigen, this is not self marker. This is an antigen. It's something foreign. I have to attack. So this is antigen. The lines of defense, the barriers that we talked about, which is the first line, followed by innate, which is non-specific, followed by adaptive, which is specific. We will discuss the details now. So the first one is physical and chemical barrier. The physical barrier, we call it surface barrier. Surface barrier. And again, this is your first line of defense. It's your skin, intact skin. Remember that I told you, if your skin is injured, it doesn't do the work anymore. It's not a barrier. And all the lines of any cavities or tubes inside your body, like cavities like the lining of your mouth, the lining of your pharynx, esophagus, trachea, whatever it is. These are the physical barriers. Chemical barriers, it's associated with this, and we will talk about it. If you pass this, if an attacker pass this, um, it's going to encounter the next line, which is the innate immunity. And this is non-specific. What do you mean innate? We are naturally born with it. It works immediately. It's not adaptive. Okay, just 1 second. All right. So The first line I mentioned is the surface or a physical. Surface is the same as physical and chemical barrier. The next is innate, and this is something that we are born with it. And because we're born with it, it's ready to work. It work immediately, but it's fast to work, but it's fast to go. So it work for short period of time. It's not long term. It's ready to go. Will work for some time until you build the long term ones. So it work immediately, fast to work, but fast to leave. Short time meaning. And we have different things in this category. We'll discuss it. And the third one will be the adaptive one. This is the acquired or specific because it's acquired. You need to be trained. You need to adapt to it. So it needs some time. That's why it is slow. It takes time, slow, but it will provide you long-term protection. And a good example for that is like your vaccine, for example. When you take the vaccine, you're not protected right away. It takes time. But when you take it after like 2, 3 weeks, whatever, uh, you are going to be protected against like flu or something like that or COVID. Not 100%, but most of the time you're protected for a long time, for a year maybe. But this one is immediate. It takes like hours or maybe a couple of days and then goes away. And this is mainly lymphocytes. We will discuss it. So here are the barriers. Surface is the same as physical and then chemical. And then you have innate and adaptive. Uh, the white blood cells are the ones that are going to do the work together with the chemicals. We will discuss it. Innate is non-specific, but it is fast and short. Adaptive is acquired, specific, long-term. So the first one is the surface or the physical barrier. And here it is. We talked about uh, the cover, which is like the skin, the surface, or the physical barrier is like skin and mucous membrane, anything lining cavities or tubes inside your body. So skin, digestive system, and so on. But there is something here that's also important, which is the bacteria associated with the physical barriers. This is something important to know because the bacteria associated with the physical barriers are not always bad. Actually, most of the time, it's not even bad. It's either harmless, it doesn't harm you, and sometimes it's even beneficial. The bacteria associated with the physical barriers, some of it is bad pathogens, but a lot of it is either harmless, it doesn't do anything, and sometimes it's even beneficial. It helps you. How does it help you? First of all, those ones on your skin, the good ones, are going to prevent, it's occupying the skin. So if the bad ones come, they are going to like be crowded and fight it. So it's actually protection. The other thing is in certain parts, it's going to produce acid, like in the urinary tract or even in the reproductive system, in the vagina, for example. There is something called lactobacillus because they produce lactic acid. And this acid is going to inhibit any pathogens, inhibit fungus or yeast. So our urinary system, like our urethra, is it acidic? It is acidic. Is that something in purpose for a reason? Yes. It should be acidic because it's in contact with outside. Anything that can goes in. So that's why if something is going in, it's acidic, it will kill it. Vagina, same thing. It's open to the outside. So something going in, it will be encountered by the acidity of the vagina. Same for the urethra. It will encounter the acidity, and the acidity will inhibit or fight it or even kill it. That's why uh, it is actually beneficial. It's not bad. So some of it are harmless and some of it are actually good because they prevent harmful species from invading. By the way, if you like get rid of these good bacteria on your skin, the bad bacteria will occupy the whole skin and it will be even worse. So that is good. Not only that, actually, inside your digestive system, there are some bacteria in the colon specifically that even produce vitamins, believe it or not. They produce vitamins. So there are a lot of good bacteria that's helping us. So we talked about the physical barriers, and I already told you that the physical barrier is like skin and mucous membrane, inner lining. Um, and I said the chemical barrier is associated with it. Like what? Like lysozymes, for example. These are enzymes that are associated with the fluids like the tears, the saliva, the gastric fluid, the urine, and so on. These are chemicals associated with it that are going to kill the bacteria. Also, part of the physical barrier are the sticky mucus. If like dust or bacteria or something that's going in when you breathe, there is always like we do not breathe like completely clean air. So if it goes in, whether it is bacteria or pathogen or dust, whatever it is, when it goes in and then it will encounter this mucus inside, something that's going to trap it, and then you spit it out. When you spit, like in you cough with mucus, right? Sometimes it's called productive cough. Like you cough, 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 and then you spit out. What you're spitting out is this mucus that's naturally produced inside, so that if something is coming in, it will stick in it because it is sticky mucus. And then you get rid of it, so it will get rid of a good portion of these bacteria. It also contains enzymes. This is the chemical part. So not only stick, not only the bacteria going in, the dust going in, doesn't only stick in this mucus and then you spit it out. No, it actually contains some antibacterial enzymes. Lysozymes. Zymes, it's coming from enzymes. Lyso, it's coming from lysis, which is breaking down. So lysozymes, enzymes that break down. You also have something called cilia. What's a cilia? It's also helping the same way. When something goes in, like in your nose, you're breathing bacteria, dust, or something, not only that it will be stuck in the mucus, but also you have cilia, like finger-like projections that are going to sweep out the pathogens until you kick it out. The other fluids acting as a physical barrier, like your tears. If you ever wondered, why do I have tears? It's always there, not just because you're tearing, it's actually produced all the time in small amounts. Why? Physical barrier. And it contain antibacterial. Your saliva. Yes, because the food and anything entering is not completely clean. The acid in your stomach, the urine, even when you have a little bit of diarrhea, you're moving out fast to get rid of these pathogens. So here it is, these different types of barriers. We have physical barriers, chemical barriers. Is bacteria on our skin, is it usually harmless? Most of the time it is. It's not always. It's usually most of it. All bacteria in our digestive system is dangerous? Of course not. Some of them are harmless and some of these are actually friendly. They produce, they help us. They produce vitamins for us. They fight the bad bacteria for us. Enzymes that are associated with the different fluids, it attack bacteria. What do you call it? Lysozymes. Lyso, lysis, breakdown. Zymes is part of the enzymes. The cells that actively move and sweeping out the pathogens is called what? It's called cilia. Now, what are the different types of cells, of white blood cells? We talked about those before, if you still remember. Uh, there are neutrophils, basophils, mast cells, macrophages, and eosinophils. And then we have the lymphocytes. Neutrophils are the eaters, the phagocytes. They eat the bad stuff. Eosinophils, same thing, but it's more toward the parasites, not any pathogens. Parasites, to be specific. Basophils help in inflammation, and I will talk about the inflammation. Macrophages are the big eaters. Dendritic cells, don't worry much about it. It's another cells that are in the immune system. But lymphocytes, B and T, we have a lot to say about this. There are cells, some of these cells, white blood cells, are called natural killers. Natural killers, cells. These are cells that are going to kill your natural cells. Kill my natural cells? Yes, in certain conditions. If your cells are already infected, it's not going to work anymore. We will kill it, your natural cells. If your natural cells contain tumor, we will get rid of it. So to remember it, I'm just trying to help you memorize it and remember it. Natural killer. They kill the natural cells if and only if they are infected, meaning there is a virus that attack it or something. Yes. Do you need it anymore? It's not only useless. It contains virus inside. Why do you need it? It's your natural cells, I understand, but you don't need it anymore. So these natural cells, if it is infected, virus inside of it, we will have to get rid of it. Natural killers. Natural killers also kill your own cells if it contain cancer or tumor. Innate cells, innate immunity. So we talked about physical barriers and chemical barriers, natural killers. The innate, which is the second line, this, something that you are born with. What am I born with? That work fast for a short period of time, but it's ready to work right away. You have something called complement. You have inflammation that work right away. If you have like a splinter or something that goes onto your skin, you get inflamed in very short period of time. Fever. Fever is actually helpful. We hate fever, but it is helpful. And all of that, it doesn't need training. It doesn't need adaptation. It doesn't take time. All of this will work right away. So if a pathogen invades you, your innate system is ready to work. It will attack. What do we have here? We have macrophages. These are cells that are ready to attack the pathogen. And when they attack it, they are going to eat it. Remember the sequence. Macrophage are the first ones, ready. Cells that are ready, the big eaters. Once they see a pathogen, they go and eat it right away, irrespective of what type it is. It's ready to work. It's waiting. Uh, this is your guard. Somebody coming close to you, the guard will attack. So the macrophages, anything that goes in, the macrophage run, eat it right away. And then what? And then they are going to release chemicals to call on the rest of the cells to come over. But the macrophages are the first one to come over. They release chemicals. These chemicals will attract more cells to come, the rest of the white blood cells. And they are also going to activate something called complement. What's a complement? Complement system or complement protein. Protein that complement the function of the immune system. Um, How do they help? What kind of help do they provide? Do they like kill something? No, they don't kill. They attract more phagocytes to come. So they go into the pathogen and it will attract phagocytes to come over and eat them. So they stick themselves with the pathogen. And they also make something called membrane attack complex. And this membrane attack complex, like this, it's going to make an opening in that invader. It's going to make like a pore, like a hole, like an opening. It's going to poke it so that it will be destroyed. And this is how it's helping us. So what's the work of the complement? Two things. Complement is something that's innate. We're born with it, ready to use, work immediately for a short period of time. This is one of them. Complement. Talked about macrophage. Complement is another one. And then we will talk about inflammation and fever. What's a complement do? Two things. Number one, it goes to the pathogen, attach itself to it, stick itself to it, so that the rest of the phagocytes will come over. When they find the complement attached to something, they will say, oh, that must be something bad. That's why the complement is attaching to it. The other thing, it can make a complex to make a hole into the pathogen so that it's going to die. If at any time, if you make a hole, if you make a like, if you poke it, it will be destroyed because as long as it is covered, it's protecting itself. I'm talking about the pathogens. But once you poke it or you make a hole in it, it will be gone. It will be destroyed. Second is inflammation, and inflammation simply, I think all of us got some inflammation uh, at any time of your life. Like, what do you notice in this inflammation here? If I get inflammation, I notice that it is swelling, it's hot, it's painful, right? Swelling, hot, painful, red, reddish colored. These are the different criteria, and every one of those is happening for a reason. Why is it red? Because the blood vessels dilate so that more blood cells come over and help. The damaged cells that were attacked, whatever the attacker is, it might be a splinter, a piece of wood, a pin, or a bacteria, or whatever it is, anything that's started this, the damaged cells are going to produce chemicals, and this chemical is called histamine. The histamine is going to dilate the blood vessels, bringing more blood, and that's why the area would be red and swelling. It will also be painful because the swelling is pushing on the nerves. Is this pain? Is that something bad? It's actually, if you think about it, because it's painful, you will leave it alone. You're not going to like make pressure on it or something. So everything here is happening for a reason. If you put your hand on your inflammation, you will see it hot or warm. Is this something also happening for a reason? Yes. Most of the pathogens that invade us, they like our normal body temperature. If it is hot, this is abnormal to them. It will inhibit them. They will not feel comfortable. They will be slowing down. They will be inhibited, right? Like if I want you to work, let's say you're working as a builder, for example. I will make you work like not in the middle of the summer, in the middle of the heat. No, I will make you work like when there is like some shades or something, and I'll give you something, and you will work more and produce more if the weather is comfortable, right? It's very natural. But if I ask you to go to that area that's extremely hot and the sun is always there, you will not be productive, and you will be like, oh, I feel tired, I feel bad, I don't have energy. And this is what we're doing to these pathogens. When the heat goes up, these pathogens will be inhibited. slowing down, tired, and this is good, so we can defend ourselves. So here are the innates. Something is invading you, let's say these bacteria. Phagocytes are going to attack it, eat it, produce pathogens, and the other types of cells are coming. If you have injury, uh, the mast cells are going to release histamine. Look at these vessels versus these. This is dilated so that more blood come, and it will give the area the swelling appearance and the red appearance. Now, which one of the is immune system that generally defend, and it includes complement and inflammation and fever that we just talked about? This is the innate, of course. Which one of those three kill the pathogen by forming membrane attack complex? Uh, and it is, we also said it's poking by working this membrane attack complex. It's the complement. We talked about it. It's right here. Here. Complement. So it is a complement. Which one of those three is triggered by neutrophils and macrophages? Neutrophils and macrophages here. Neutrophils and macrophages like these. Remember, they are going to attack, and they are going to trigger the rest of the cells to come over, and also they are going to trigger the inflammation. So inflammation is the one that's triggered by histamine release from those. Um, which one of those develop, the body temperature is too high and the function of the pathogens will drop. Of course, it is fever, because fever means high temperature. Now the acquired, the one that needs time to develop. Remember, it is surface barriers or physical and chemical barrier, followed by innate, complement, macrophages, inflammation, and fever. Now the next level that takes time to develop, but it is specific, adaptive, acquired. There are two types, depending on if the antigens are inside the cells or outside of the cells. If the antigen is outside of the cells, this is called antibody-mediated or humoral immunity. Like this pathogen here, it has this on the surface, antigen on the surface. So you're going to release antibodies because you see it an attack from outside. This is antibody-mediated. If the antigen is inside, then you have to attack the cell itself. And that's why we call it cell-mediated immunity. Here are the different types. I'm not going to pay much attention to this, but here are the two cells that do the work for you, T and B. T is the one that's responsible for cell-mediated. This one, cell-mediated T. Antibody or humoral-mediated B types. So T, the name came from thymus, because this is what activates. Let me tell you this. We make T and B lymphocytes. We make lymphocytes in general. Look at this. This is in the bone marrow. You produce all the cells in the bone marrow. How about the lymphocytes? I said all cells, red blood cells, white blood cells, platelets. Remember, we talked about this. We make all of them in the bone marrow. So do you make the white blood cells? It's everything. We make everything. Including the lymphocytes? Yes, including the lymphocytes. B and T? Yes, everything. So you make T, B and T in the bone marrow. But, listen to this. This is important. Where do you make those two? Bone marrow. But it is not mature or active yet. It's not specialized yet. The B type will be activated here in the bone marrow, and here is the reason why we call it B, because it's produced and activated. The name comes from the activation. Bone marrow, B, the first letter of bone marrow is B, B lymphocytes. While the T is also produced in the bone marrow, but it's activated by the thymus. And this is where the name came from. So you need to know those two types are responsible for adaptive, but you need to know where the T came from and where the B came from. Both of them are produced where? In the bone marrow. How about the activation or specialization? T by the thymus. B, bone marrow. The B is the first letter. So here it is. You make both of them in the bone marrow. B, you make it in the bone marrow, and you activate it in the bone marrow. T, you make it in the bone marrow, but the thymus activate them. And then both of them will go to the lymph nodes. Remember, I told you in the lymph nodes, you have macrophages that's already there, plus T and B, when they are activated, they go and settle there and live there. So you have the physical barriers to protect you. Pathogen bypassed it or go through it. Okay, now I have the next line, innate, which includes complement, inflammation, fever, macrophage. What if those are not able to stop the attacker? The third line is going to defend you because this is specialized, but they need some time to develop. B, produced in the bone marrow and activated in the bone marrow. T, produced in the bone marrow, activated by the thymus. B, work through antibodies. Remember, extracellular antigen. If the invader have antigen outside, B cells release antibodies that attack this antigen on the surface. That's why we call it antibody-mediated immunity or humoral. While the T cells, they do different thing. If the antigen is inside, the T cells come and attack the cells, and we call that cell-mediated or cytotoxic. Cyto is cells, toxic means kill, so it means cell-mediated. There are other types of the T. One of them is called T helper, and the name came from the help the other types of T and the help the B to do their work. Also, there are another type of T that's called memory cells. When the fight is over, when you kill the pathogens, you're done. The fight is done. Not all the cells will be gone. They will leave some memory cells, and this will wait because just in case if something attack you, okay? And that's why they tell you if you're sick now, you're protected for some time. What is that sometime? I don't know, maybe a month, maybe two, maybe a year. It's different. But it's the time that these memory cells survive as a memory. B cells also make their own cells, memory cells, B memory cells. So after the fight is over, you leave some memory cells waiting just in case if something happened again. And this is the time that you are protected because the memory cells are going to stay. If something come, remember, it take time to make it. But at this time, it doesn't need time. It's there. It's memory. If that's not clear, let me make it this way. Um, Somebody is invading the country, and the first line of our military is waiting, and it will fight them. If they, if the invaders can overcome, or they can go through the first line. The second line is waiting for them, also waiting to fight. If they fight them, now we will say, okay, they coming with tanks. We will send people that can work against tanks. These are coming like with these weapons. We will send people specialized for these weapons. Okay, and they are going to fight for a long time. And then after, let's say, the invader got defeated and everything is gone, we won the fight and everything is over. At this time, we will say, wait a minute, what if they come again? We can't just go to back to normal life and everything disappear. And then if they come again, we are not ready. We take some time until we were able to adapt to them and understand them and fight them. So what we're going to do is, not all of us will go back. Some of us will stay, remember the scenario that happened, remember how the attackers attacked us, and how they fight us, and how they attack. So it will keep a memory for that. And then like next year or something, when nothing happened, okay, now we're safe, go back. This is just to understand how does it happen. So again, you produce B cells. It's inactive. When they encounter the attacker, they become activated into B cells that's active now, and they produce antibodies. And they will leave some uh, memory cells. Same thing for the T. Antibody, what is the antibody that's produced from the B cells? It is a Y-shaped protein like this that will go to mark the antigen. Does it fight the antigen and kill it? No. It go to the antigen, stick with it, marking it, and then when our white blood cells come over, they find the antibodies that's marking the cells for them. Like when you attack, like when you hold somebody, don't kill them. Just hold them until the police come, and they will take him. So this is what the antibody is doing. They mark it, they attach to it, to the antigen of these foreign cells, until the white blood cells come over and eat it. So the antibodies alone, they do not destroy. And this is for the B and B cells. T cells are different. T cells are also inactive, and they are activated using the thymus will activate them, but these are cytotoxic. And cytotoxic means they attack the cells. So they attack by themselves, not send antibodies to mark and then attack. No, they attack. And they are going to also leave memory cells, just in case. The B cells are the specialized ones for adaptive. Antibodies coming from the B target what? Extracellular. They mark, they attach and mark from outside. Cell-mediated, on the other hand, they target what? Intracellular. And because it is inside, you have to attack the whole cell. The antibody, the shape of the antibody is unique for the antigen. Look at this. If this is an antigen that's outside, how the antibodies mark it? They go like this. Their shape is specific for the shape of this antigen. How about if the antigen looks like this? Yes, the antibodies that will fit with it will come and mark like this. So they have specific shape that fits with it. Okay, now I'm gonna give you 4 scenarios. I think we're almost done. I'll give you 4 scenarios, and please understand this as we go because it's important. I will try to summarize it for you. The types of immunity. If you do work actively until you produce your own antibodies, we call that active. If you take something from outside and you didn't make any effort, we call that passive. Examples. the baby, the fetus inside the mom, take antibodies from the mom. Did the fetus do any effort? No. He's taking ready to use. Let me just relate to normal life events, daily life events. Listen to this. You can get components, like you can get the flour and get some oil and get some tomatoes and paste and you make pizza from scratch. Or you can call Pizza Hut, they send you pizza ready to eat. When you call the pizza that's coming to you ready to eat, this is passive. You didn't make any effort. While if you make the pizza from scratch, this is active. So this is active or passive. The other thing component is natural or artificial. What does it mean? Natural or artificial. Natural is something that happened to everybody automatically. You don't decide to do it, or the doctor doesn't decide to do it. Natural. Give me examples. Doesn't every single fetus on earth take the antibodies from the mom through the placenta? This is natural. Okay. Um, if you got sick, everybody gets sick. This is natural. The thing that's not natural, on the other hand, is if I give you vaccine, does that happen to everybody? No. Is that something natural, naturally occurring, like it just happened, or you decided, or your doctor decided that you should do it? If the doctor decided, it's not natural. Okay, like they take this vaccine. The vaccine is killed virus or uh, weak virus or something component, and it when they put it like in your shoulder or something, the body will work actively. It will come to it, recognize it, and the first line and the second line and the third line, they will understand it and adapt to it, and then it will make the antibodies to fight it and so on. So you're doing the effort. This is active. And is that something natural? Like every single person on earth, does it have happen naturally? Like you're walking in the street and then like a vaccine needle get into your skin? Of course not. This is not something natural. This is artificial. The other thing is if you go to the hospital and they tell you, you know what, your body is not working very good. We are going to give you IV antibodies. Did you do any effort? Or this is like delivery, like pizza delivery. You didn't make any effort. So this is passive. Is that something natural? Like everybody walking in the street or something, or baby or something like that? No, it is not. This is something that not naturally happening, and it doesn't happen to anybody. You're given these antibodies. So if I give you 4 scenarios, I will ask you to tell me what type it is. Uh, uh, if you guys are still paying attention. You got sick. This is scenario number 1. You got sick. Is that active or passive? Is that natural or artificial? What do you think? Active or passive? You're infected. This this is something, does anybody know? It's natural. You got sick, it's natural. Why? Everybody gets sick. Natural. Something happened naturally. It's not intended. It's not you decided. Natural. Number 2, is that active or passive? Of course it is active. You got infected. Did you get anything ready to use? No, you're going to make your own stuff. Scenario number 2, a baby or a fetus in the mom's uterus getting the antibodies through the placenta. Is that something natural or artificial? Is that something active or passive? Number 1, it's natural.
Yeah, natural.
It's natural. Okay, is that active or passive?
Active.
Passive.
It's passive. The baby didn't do anything. He just got it. He didn't do any work, like delivery. Scenario number 3, You go to the hospital, they decided to give you antibodies through the IV. Is that something natural or artificial? Is that something naturally occurring? Everybody get it?
Artificial.
It's artificial. Is it passive or active? Did you make any effort? You're
Pass.
getting it through the IV. It's passive. Last scenario, vaccine. Is that something natural or artificial? Like everybody naturally walking in the street and he get the vaccine, or this is something that's artificial? You decided to do it.
Artificial.
It's artificial. Is that active or passive? Did you make the effort or did you get it ready to use? I'm talking about the antibodies. Did you get antibodies or you fight the vaccine and you make your own antibodies?
I think it's passive.
It is not passive. Let me say it this way. When you get the vaccine, don't you feel sick, kind of? Like you say, my shoulder hurts, it's red, and I feel a little bit of a fever, right? This
Oh,
is
yeah.
your body actively working to make its own antibodies. You, it's only passive when you get the antibodies ready to use. Okay. Um, I know that I'm not asking if it is passive giving you the vaccine. Of course, they gave you the vaccine, but this is not what passive and active is about. The passive and active is, did you get the antibodies ready or you make your own? If you get the vaccine is a virus or killed virus or weak virus. You didn't get any natural or any antibodies that's transferred to you. You make your own, and that's why you feel sick. If you get the COVID, like personally, I felt like there's some pain here, and I got some a little bit of a fever, and there's like sore a little bit. You know, all of this is because you are actively fighting this weak virus. We're not infecting you, but we're giving you like weak or killed virus so that your body actively work and attack this. It will not get sick, like not get the actual viral infection. Like you give you COVID, they give you a component. So you are going to work and make your own antibodies. So this is active. So I hope if you see any of those scenarios, you know it right away. 4 scenarios.
So would you have active immunity if you didn't get the vaccination and you have natural antibodies that beat it? So now you get the defense because the
Uh,
vaccine is supposed to prepare your body to fight. But if
yeah,
your body learns,
the vaccine prepare you by to the fight, but
yeah,
what do you call the vaccine? The vaccine, it is not natural, it is artificial. And is that active or passive? Vaccine, active, because you're going to make your own antibodies. So remember this, natural doesn't mean you make it. You make it, it means active. So we
no,
are talking about,
I'm, I mean, if you don't get the vaccine, doesn't your body become active on its own to fight?
if you got the virus, if you got infected,
Right.
yes. So that will be natural and active, both of them. So for each one of those, we need to know, is it active or passive? Is it natural or artificial?
Okay.
Which is also called acquired.
All right. Okay.
Um, so this is what I wanted you to know in this part. This is how the virus looks like. The virus is not a real cell. It is a particle. Um, Something can look like this, like this. Uh, you don't have to know the details of the virus. What I want you to know, the most important is it is not a cell. It does not have genetic material or wall. I mean, a membrane. No genetic material like the natural ones that we have in the cells, and no membrane. So it does not reproduce on its own. Okay, it needs your own nucleus. They go inside your cells, inside the nucleus, and order your DNA or to multiply them or help them to multiply and reproduce. While the bacteria, on the other hand, it's an actual cell. They can reproduce by themselves. So this is basically what we wanted to know. Otherwise, it is a summary. So I'm going to stop here.